HIPAA and interoperability. While an old issue, HIPAA's privacy rule has long been blamed for interoperability issues, although from the perspective of organizations not always interpreting the rule correctly or being fearful and extra cautious. As value-based care unfolds, it is essential that both privacy and data sharing are compatible. The Office for Civil Rights, or OCR, has primary responsibility for enforcement of the HIPAA privacy rule, but works closely with the ONC to understand and address current issues relative to privacy in relationship to health IT. OCR has recently issued several advisories, created blogs on its website, and conducted research in an effort to help providers largely, as well as health plans and patients, understand their rights and their responsibilities. An interesting finding is that their research shows most patients think more sharing of information is occurring among treating providers than is actually the case, which is completely counter to what the providers think. This research also suggests that patients see that as appropriate for patient care. Finally, there are other interoperability efforts going on in other parts of the federal government and in the private sector. I want to highlight just a few of these. The Healthcare Payment Learning and Action Network, abbreviated LAN, convened a value-based data sharing requirements initiative. And this has acknowledged technical interoperability challenges and creates opportunity for more efficient solutions through shared service approaches. The LAN was formed around the time that value-based care was introduced by the Centers for Medicare and Medicaid Services, CMS, and focuses its work on value-based care initiatives. So they're not just about acknowledging technical challenges and trying to address interoperability. It's more than that, but it's a very excellent resource for kind of what's going on right now in all of value-based care, as well as specifically the interoperability issues. The Substance Abuse and Mental Health Services Administration, often referred to as SAMHSA, has issued guidance in the past that relates to how to interpret HIPAA in light of their mission. Although many believe they have not fully addressed the need for mental health sharing issues, alcohol and drug abuse has been covered in two documents: the Confidentiality of Alcohol and Drug Abuse Patient Records Regulation, the HIPAA Privacy Rule, Implications for Alcohol and Substance Abuse Programs, and more recently, the Applying the Substance Abuse Confidentiality Regulations to Health Information Exchange. Health Information Exchange Standards and Interoperability, often referred to as S&I, has been well known for its work in supporting health information exchange, but unfortunately has pretty much gone by the wayside, as its work sponsored through ONC was last updated on February 27, 2014. Still, there are some very good resources on their website and worth taking a look at for further information. The National Governors Association, a private entity but made up of state governors, created a roadmap for states to improve health information flow between providers. Called the Getting the Right Information to the Right Healthcare Providers at the Right Time, is a very recent document that reflects concerns that every state has different privacy statutes of its own, making interoperability, at least the policy and process interoperability, even across an integrated delivery system it resides in many states, challenging to understand and ensure accuracy. Now, there are other interoperability efforts going on in the private sector as well, really too numerous to acknowledge here, but I do want to acknowledge that this is definitely top of mind. And as we said before, if value-based care is to succeed, interoperability definitely needs to be achieved. Not only is it the top concern, but in all of its manifestations has great impact on the ability not only to share data, but to form trusting relationships among all parties to value-based care success, including patients, providers, health plans, and vendors. And certainly that process and policy, not just from the federal policy, but the internal private sector policy, really is needed to ensure that we can get along with these organizations with whom we share an interest in value. So this concludes our first lecture in Unit 6. I look forward to your participation in the second lecture that will address analytics, even including how analytics might help interoperability. Reference listed here, as always, should provide you with more detail on each topic discussed if this is your particular area of interest.